individuals have problems in their speech, language, or swallowing may seek speech therapy. Speech therapy is the treatment that will be given to individuals who have speech and communication disorder. Speech therapy will be performed by SLP or speech language pathology. In the past, speech pathology was used among the professionals to describe themselves. However, nowadays, the term commonly used is speech language pathology. Speech therapist, speech correctioner, and speech teacher, all of these are referred to the same profession, which is speech language pathologist. However, speech language pathologist is the preferred term because for them that was the essence of their work, which is the language and the speech. Both children and adults may get the benefits from the speech therapy and help from the FLP. However, it's a little bit difficult for the parents to notice their child in problem regarding speech and language because every children have their own phase in their development. The parents can start bring their child to speech therapy as early as 3 years old if their kids have articulation, while for others they can start as early as 4 years old.
Now, let's continue on the literature review of the effectiveness of the speech therapy in treating the dysarthria, aphasia, and autism. The effectiveness of the speech therapy has been proven in dysarthria with the use of the LSVT, the Lee Silverman voice treatment. A research has been done on 2020 amongst two groups of the cerebral palsy and the Down syndrome kids has proven increasing in the vowel duration, also the acoustic vowel space. Using the speech and language therapy in treating aphasia is not a new thing for therapists. For example, a research done in 2017 has proven the effectiveness of the SLT via video conference, which is the internet-based, and has indicated an improvement in functional gains and confidence between 2 months. For autism cases, the speech therapy has proven its effectiveness through the PECS, the Picture Exchange Communication System. So a research done in 2008 for 3 preschool children has shown that 2 of the 3 preschool children has increased and mastered of all 4 phases of the PECS.
Hi and Assalamualaikum. My name is Aina Hadra binti Zainal, and today I will talk about the uses of speech therapy in dysarthria. So what is dysarthria? Dysarthria is a neurological motor speech impairment caused by the inability to control muscles. Those muscles which is necessary in our speech productions, including muscles in our face, our lips, our tongue, our throats, our palates, and also the muscles for breathing. Dysarthria is caused by neurological impairment and can be present either congenital or acquired. So congenital means you are born with it, for example, cerebral palsy, and also acquired means like Parkinson's disease or traumatic in the brain injuries. According to Pennington, Millers and Robson 2009, they stated that children with dysarthria often have irregular, shallow breathing and speak small residual pockets of air. They also have low pitch, harsh voices, less coordinated speech, and also poor articulations. Combining both of these attributes will lead us difficulties to understand what the child is saying. Individuals who have this kind of characteristic needs to see speech language pathologists to evaluate their speech and find out what type of dysarthria they have. So, move on to the benefits of speech therapy in dysarthria. Speech therapy helps them to control the movement of breathing and also speech so it becomes more intelligible. Based on Yatsen 2001, speech therapy will help improve speech skills by adjusting the rate of speech, improve brief support during speech so children able to speak louder, using of oral motor exercise to make lips, jaw, and tongue stronger, and increase movement of jaw, lips, and tongue. This therapy will be conducted according to the symptoms and types of dysarthria the child have. In severe cases, simple gesture, picture boards, and also alphabet boards is used. It's about a girl named Caroline Johnson who had a stroke in uterus and developed hydrocephalus. So the prognosis stated that she will unable to eat, unable to hear, unable to talk. However, the parents never give up. So what happened is that they met a speech language pathologist. The therapy helped Caroline to figure out how to make her mouth work and how to plan those movements. The therapist includes a lot of cueing, telling her how or where to put her mouth, her lips, and also how to break up difficult words into more manageable pieces. Therefore, this is to show how speech therapy helps those with dysarthria.
Assalamualaikum and hi, my name is Suzaina binti Mat Yassin. Today I'll be discussing about the usage of speech therapy in treating aphasia. First of all, we need to know what is aphasia. Aphasia, or the inability to communicate, is a common problem among the older adults. It is often occurred after stroke or due to the acute medical condition. People with aphasia experience difficulty in reading and writing, and they also find it hard to communicate and understand others. According to the American Speech Language Hearing Association, ASHA, aphasia is an acquired neurogenic language disorder resulting from the brain injury, typically in the left hemisphere. There are two types of aphasia, broca aphasia and Wernicke aphasia. Broca aphasia is where individuals find it hard to communicate and understand others. Meanwhile, Wernicke aphasia is where individuals only have limited comprehension and they find it hard to express themselves. There are two types of speech therapy for aphasia: impairment-based speech therapy and communication-based speech therapy. For the impairment-based speech therapy, the goal is to improve language functioning. It involves stimulating reading, speaking, listening, and writing skills. This therapy focuses on tasks that promote both speech and comprehension. Next is the communication-based speech therapy. Communication-based speech therapy is designed to enable individuals to communicate in any ways and encourage support from the caregivers. These treatments are meant to assist people with aphasia to convey message and feelings in a new way. I'm already done with all the explanation. Now, I'll proceed to the video. The video that I'll show to you after this is an example of communication-based speech therapy. Happy watching!
Okay, so tell me your name.
Miss Owen.
As you can see in the video, it shows a conversation between a therapist and a 17-year-old aphasia patient named Michelle. This video was recorded on April 25th. Basically, it was just like a normal conversation between the therapist and Michelle.
Can you tell me the days of the week, starting with Sunday?
Sunday, Saturday, Monday.
Alright, and I wanted you to tell me about a movie that you know really well. So can you tell me what The Wizard of Oz is about?
It's about this girl who she kept all her stuff, and she had a boy and
Toto?
Yeah,
Her dog, right?
Yeah.
Here, the therapist was just trying to show Michelle the correct usage of words and how to pronounce it properly. This video, the therapist also helped Michelle to explain or describe things that he couldn't explain with her own words.
I can't explain.
Okay, so I think you were starting to tell about how she lands on the Wicked Witch,
Yeah.
kills her, and then meets a good witch, and then starts on her journey down the yellow
Yeah, big road.
good Oz. Okay, thank you so much.
Thank you.
There, I will be explaining about how we use speech therapy for autism spectrum disorder, ASD. So generally, ASD is a neurodevelopmental disorder that can be diagnosed from the age of 3 and display deficits in social communication, and also they perform repetitive or restrictive behavior. So when we talk about how speech therapy is related to ASD, is that children with ASD, they usually repeat the same words, or they grunt and they cry a lot, and sometimes they have difficulties in pronouncing a certain words. Hence, the therapist will use either the technique where they use board with pictures on it to help the children pronounce several words, or they will have to massage their facial or lip muscles to aid the articulation of words. Speech therapy helps children with ASD to improve their verbal and non-verbal communication. So for instance, the younger children with ASD have trouble in pronunciation and articulation of words. Hence, speech therapy helps them to learn how to pronounce and also to improve how they pronounce several words. For instance, some children might have problems in even pronouncing the word tree, so it guides them to pronounce the words. So other than that, speech therapy helps children to learn the proper communication skills that are needed to communicate with their peers and also their social setting. So in this video, you can see how the therapist is helping the child by giving him treats to help him articulate and pronounce words 1 and 2. So if you see, she places a treat at either sides of his mouth to help him pronounce the word.
Hi, my name is Dysarthria. So throughout the whole video, you've learned a lot about speech therapy, like its definition, its uses for dysarthria, aphasia, and autism. As all other therapies, speech therapy has its benefits and drawbacks. Some of the benefits of speech therapy is that it helps to improve cognitive development and communication, as well as develop practical social skills and reading and writing abilities. As for the drawbacks of speech therapy, it is especially time-consuming and requires full commitment of the family members to actually practice the skills and strategies learned. Moreover, the speech therapy is actually costly and sometimes may have unrealistic expectations, which requires the therapists and the families to always revise their goals. So that's all from us. Thank you!